Ready to shine inside out? Welcome to Polished Beauty Podcast, where ambition meets empowerment. We talk business, beauty, brain, body. I am your host, Dr. Daisy Ayim, triple board certified cosmetic surgeon and OBGYN. Let's get polished. Hello, everyone. I am so excited to discuss this topic today on Polished Beauty Podcast. It is misunderstood. It is misused, it's miscategorized. Basically, there's a lot of confusion with this word. So I want to unpack it, dissect it, so that you become an expert on it with clarity and kind of sift it through the hype, okay? We're going to talk about bioidentical hormones. What does it mean? And how is it different from traditional hormones, okay? I want you to get from this episode understanding what bioidentical hormone is so that when you speak, you use it correctly and you can actually pick up when somebody else speaks incorrectly with the word bioidentical hormone. So I'm really excited. All right, so let's get right into it, okay? This conversation is for every woman that cares about her journey as far as her personal health is concerned. You've heard the word bioidentical hormone everywhere. It is literally all over social media. It's in wellness blog. It is in your local med spa. You have celebrities talking about their personal perimenopause and menopause journey and throwing this word bioidentical hormone in it. And so there's a lot of confusion with it. Like, is it something different and unique, or what is it, right? So I am here to kind of help you navigate it. Unfortunately, I also mentioned some of my colleague physicians and mid-level providers, nurse practitioners, PAs, and other healthcare entities sometimes use the word bioidentical hormone incorrectly. And that also adds to the confusion, right? Because if you're an everyday person, you don't understand that word, and you hear someone that has title use it in a certain way, you're going to believe that that's what it means. So my hope at the end of this podcast is that you get it and you're not confused anymore and you have total clarity. So let's start with the very basic. What is bioidentical hormones? These are hormones that are chemically similar to the hormones your body produces. So the chemical and the molecular structure is exactly like what your body naturally produces. So in this case, we're going to focus on estradiol, progesterone, and testosterone. So bioidentical hormones are hormones that are similar to these three hormones that your body naturally produces. The chemical structure is the same. The molecular structure is the same. So think of it as a square. If estradiol is a square and you get a bioidentical estradiol, it's still going to be a square. You have not changed anything in the structure. So that's what bioidentical hormone is, all right? So estradiol, for example, it's one type of estrogen that your body produces a lot prior to perimenopause and menopause. Just for a fun fact, there are 4 types of estrogens that your body produces, okay? There's estradiol that I just mentioned, there's estriol, there's estrone, and then there's estetrol. So those are the 4 types of estrogens that your body produces. Now that you have that together, understanding that bioidentical estradiol is exactly like the estradiol that your body naturally produces, okay? There's no different. Now, compare this to synthetic or conjugated estrogen. This is when the estrogen has been altered. That shape has been changed in one form or another. So it's no longer a square. It's a square with like a little swiggle tail. That is not estrogen, right? So that is a synthetic or a conjugated estrogen. So that's the difference between that. Okay. So for women, think of birth control pills. All your birth control pills on the market are mostly conjugated estrogen. So they are synthetic. There's only one birth control pill that isn't. And I'll mention it just for the concept of contrasting between synthetic and non-synthetic. And that estrogen and that hormone or that birth control pill on the market is called Nextstellis. But that's not why we're here today. Understand that all birth control pill on the market are synthetic or conjugated estrogen. So they're not like estradiol that your body naturally produces. So when your body produces estradiol, it is bioidentical and is similar to the bioidentical formulations out there that we give you to take. I hope that doesn't confuse you. All right. So the idea of a bioidentical hormone that is given to you is to mimic the ones that your body naturally produces. So imagine as a lock and key, right? If your body is the lock and we give you the key to unlock it, that is bioidentical. So we know that key to give you. Very simple, but very easy to understand. So how does it work? Well, our hormones are powerful messengers. Think of them as someone or something that carries a message from one place to another. And estrogen supports everything in our body, from our vaginal tissues to our brain, to our heart, to our bones, you name it. So our skin quality, all of that is dependent on estrogen, okay? Progesterone, on the other hand, it helps balances estrogen. So they go hand to hand. You need estrogen and you need progesterone. So it's a good balance. And the progesterone effects help support sleep, mood, your uterine health. Testosterone also plays a role in our body. It helps with libido, helps with energy, it helps with lean muscles. So you need all three hormones, all right? When these three hormones decline, you start experiencing symptoms. And these symptoms can be very mild, where you're tolerating fine, you don't need any resolution, or it can be very severe, where it really disturbs your quality of life and you want to get something else or something to fix it. So you therefore seek therapy, all right? So it's very important to understand that the decline of estrogen affects your sleep changes, your mood swings, your hot flashes, your vaginal dryness, your low libido, and even your shift of metabolism. This is going to happen to every woman. To what degree you experience it is what kind of differentiate one woman from another. All of us women are going to experience menopause. Whether you show symptoms of menopause is a completely different path for all of us. Okay, understood. So bioidentical hormone therapy replenishes these hormones by allowing our body to maintain balance. So you take bioidentical hormones because your body no longer produces these hormones that was necessary. And these bioidentical hormones are molecular structures similar to the hormones your body naturally produce, which has declined. So it helps restore you. So that's what a bioidentical hormone is, okay? It basically can bind to the receptors that are available now because your natural hormone is no longer. And this bioidentical hormone can go and bind to those receptors and behave like your normal hormones, which is now gone. Are you following me? I hope so. All right. So our hormones do not define us, all right? But understanding hormones empower us. That's very important. We have to understand it so that we're empowered. Now, let's talk about FDA-approved bioidentical hormones versus compounding bioidentical hormones. So there are two categories of bioidentical hormones that can be used to treat you in menopause or perimenopause or in a hormone deficiency state. Now, let's talk about the FDA-approved bioidentical hormone. This basically means that it has undergone rigorous study, it has been proven, it has undergone safety measures, and they have determined the dosage and the outcome of the dosages. So basically, it's gone through strict process, monitoring, accountability, and basically showing any adverse event or not, and has gone through this strict process for it to be approved and available to you. So FDA-approved bioidentical hormones are out there that you can use. They're in the form of oral tablets, patches, topical gels, local vaginal insert. When I say local vaginal tablets, that's into the vagina in the form of a tablet or gel. Okay. And because they've extensively been studied, you can rest assured that the safety margin has been accounted for, and whether it works for you or not is another level, right? But as far as safety and efficacy, it is there. The hope is that when you take it, it works for you to give you relief. All right. So that's what an FDA-approved bioidentical hormone is. Now let's talk about compounded bioidentical hormone. This is basically made in pharmacies and is created to give you a personalized dosage or combinations. Now, the drawback in this is that it's not very specific in cases, and there's some tweaking that goes with it. And compounding products are not regulated in the same way as FDA-approved bioidentical hormones are. So that's the main difference. But with that said, both hormone therapy are option for you should you need to have relief for your hormonal deficient state. What is important is to look at essentially how it works for you, and a clinician or anyone that prescribes bioidentical hormone should be able to navigate both options for you thoroughly and in detail. So what does that mean? If you go to consult because you're having hormonal deficiency symptoms or hormonal balance, the clinician, such as myself, should be able to comfortably talk to you about FDA-approved compounded or FDA-approved bioidentical hormones. The clinician should be able to speak to you about compounding bioidentical hormones, and the clinician should be able to navigate both very seamlessly and offer you neutrality in the discussion, and you choose. So you have to be empowered with the information from the clinician. So imagine if you go and consult to a clinician and you're only presented with compounding bioidentical hormone, whether it's in the form of a pellet, gel, or whichever formulation, but no discussion occurs with, hey, I can write you a prescription of an FDA-approved bioidentical hormone. That is foul play in my book, because they should be able to talk about both very well to you, and you decide. Compounding hormone has non-insurance coverage, and there tends to be a higher cost to it for you to be on it. And if you choose to, that's fine. You also have FDA-approved bioidentical hormones that can be prescribed to you, which will cost you a copay, whatever your copay is. So clearly, it's not as expensive. I say that to say that if you are looking for a solution, money should not be the only reason of discussion between you and that clinician. They should be able to discuss all the options and you decide however you want to spend your money. In my practice, that's what you're going to get. You're going to get the toolbox with all the tools and you decide. But my job is to educate, inform, and you make a decision. All right. So let's talk about clinical benefits and evidence on bioidentical hormones. Many women experience meaningful relief with bioidentical hormones, particularly if the symptoms are like hot flashes, vaginal dryness, memory fog, sleep issues, mood swings, and cardiovascular. So there are some benefits on bioidentical hormones. There is evidence or enough evidence to show that hormonal therapy can support 1, your urinary and vaginal health, 2, your sleep quality and mood, 3, your bone density and fracture prevention, 4, even your cardiovascular and cognitive health can benefit from hormone therapy if started early. But I want to stress this really important to you listening. It is not a one size fits all. What that means is what works for woman A may not work for woman B. What worked for woman C may work for woman A and B. What worked for woman D may work for nobody but her. Understanding this will allow you to not feel frazzled or uncertain or confused because you don't understand why your friend went to the doctor and they had compounded bioidentical hormone and you go and get the same, but you don't get relief, or why your friend got this FDA-approved bioidentical hormone that worked amazing for her and you took it and you got neutrality. So it is not a one size fit all because we all come with different medical history that has to be put into account when deciding which hormone therapy to take, and also the benefits of it for you based on your personal history. All right. I want you to understand that treating with bioidentical hormone is not treating a lab. We don't chase labs. We don't chase numbers. We chase you and your symptoms. So what that means is that when you present to my office or any clinician and you complain of these symptoms, I should be able to write you a prescription for your symptom without necessarily doing the labs. Yes, you heard that correctly. Is it wrong to do the labs? No, but you don't need labs to get started on your hormonal therapy unless we're going the route of compounded bioidentical hormone. That's when lab discussion is a necessity or precursor to start to give you the bioidentical hormone that is compounded. If you're doing an FDA approved, you do not need labs to get started. That's just a big difference. So in general, the risk, myths, and safety of bioidentical hormone needs to be understood. Let's just get to the elephant in the room, okay? Identical, which is often referred to as natural, doesn't come risk-free. I want you to repeat after me. Just because it's bioidentical, which means natural, doesn't mean it's risk-free. Any hormone therapy can have some risk, and this risk could be blood clots, breast cancer risk with certain estrogen and certain comorbidities. Okay. You also have uterine effects. So understanding the risk profile of hormone therapy is very important. And because approved bioidentical hormones have been studied, we have the research, the data to scientifically prove the efficacy of it and any outcomes of it. Whereas with a compounded bioidentical hormone, there's no data to really give us the outcome and the dosages. And that's really the big difference to understand. One, you kind of know, the other one, you don't know. Now, how do you know if bioidentical hormone is right for you, or is it for you? So the important thing to keep in mind is that care with hormonal therapy is individualized. You and your situation is unique, and your care has to be personalized to you. No two women will have the same journey when it comes to perimenopause and menopause. There may be overlap as far as symptomology, onset, duration, ending, but rarely do you have two women alike because you're looking at different sizes, you're looking at different history, you're looking at different geographical area, you're looking at different genetic makeups, you're looking at multifactorial, their nutrition, their lifestyle. All those things would determine hormonal therapy for you. So it's a very individualized care. If you're experiencing significant perimenopause, or menopausal symptoms or other hormonal imbalances, hormonal therapy is an option. So what I look for in my practice and what any clinician should look for is your personal and family history, your cardiovascular risk factors, your timing since menopause onset, the symptom severities, and your goals. All of those things will help me come up with a personalized plan for you and any clinician as well. Follow-up labs and adjustments may be done after the history intake has been determined. In my practice, my goal is to always inform the patient, educate the patient so that you know. This conversation today on bioidentical hormone is for you to understand that there are two routes, FDA approved and compounded. Both are bioidentical. One has research data proven scientific journals and articles to support it. The other one doesn't. Women are happy with both. Women are unhappy with both. So it's a very personal choice. All right. I hope today's conversation cleared the fog around bioidentical hormones. No pun intended there. They are powerful tools when used correctly. It's rooted in science, it's rooted in individualized care for the woman in front of us, meaning the clinician treating you, and is designed to support quality of life. If you are curious about hormone therapy questions, I want you to ask the serious questions. Write them down, take it to your office, ask those questions, get evaluated, advocate for yourself. It's okay to get a second opinion if the interaction you have doesn't give you clarity or you just want to seek more. There's nothing wrong getting several opinions so you can feel more confident, educated in the process as you make your own decision. So do ask the questions and be your advocate. This episode is really important, and I would like for you to tag a friend, share it as much as you can with any woman in your life that wants to know about her health as related to bioidentical hormones. I do not want anyone to feel like they don't understand that word. Bioidentical means natural, means the chemical product is very similar to what your body naturally produces. And then there are two routes of bioidentical hormones. I keep emphasizing that. FDA-approved and compounding. Two routes for bioidentical hormone. You get to choose which one you want. One is less expensive than the other one. One has scientific data to support it, so you know it is regulated. The other one doesn't. Women are happy with both. Women are unhappy with both. So it's a personal choice, okay? If you have any questions about bioidentical hormones, please email my office, info@drdaisyayim.com. DM me, call my office. I will be glad to explain this to you one-on-one. But I hope this entire episode has cleared up the area of bioidentical hormone as related to estrogen, which is estradiol, progesterone, testosterone. Thank you. I hope you enjoyed this episode, and thank you for listening. Video recording of this episode will be featured on our YouTube channel, Dr. Daisy Ayim. We are also found on Instagram at Polish Beauty Podcast or at Dr. Daisy Ayim. Remember, new episodes drop every Wednesday, so stay tuned. Please like, share, follow.